Good morning, everybody, and thank you so much for spending some of your very valuable time with us today. My name is Elizabeth Jacobs, and I am an epidemiologist and a professor, and I'm also the mother of two sons. I'm a vocal supporter of public schools and public school teachers, having been a daughter of two public school teachers, and currently my younger son is not able to attend his public school. He is home with me today, although they started classes on Monday, because his school district does not have a mask mandate in place right now. And because I unfortunately have to take immunosuppressive medications due to a condition that just developed, he cannot attend school in the absence of public health mitigation actions. His district has no mask mandate and no remote learning option, which leaves us without a place for our child to go to school right now. And that is why I am here today, or at least one of the reasons why. I am part of the Right to Safe Arizona Schools Coalition, and this is a group of concerned parents who saw what was going on and quite organically came together with each other to battle against these restrictions that have been placed on Arizona parents. And this is also a partnership with the Arizona Public Health Association. And we really want to unite around improving public health and safety for school children in Arizona in the face of the laws banning public health measures in schools. So panelists today include top Arizona thought leaders in education, healthcare, law, and public health. We are going to lead off with Will Humble. He is the executive director of the Arizona Public Health Association and the former director of the Arizona Department of Health Services. Therefore, I view Will as one of the most knowledgeable people in the state regarding public health and public health policy. He is going to lead today's panel discussion on the current public health crisis in Arizona and the implications for our state if schools do not take immediate action and require proven mitigation strategies. At the end of the discussion, I will take questions from our media guests in the chat box. So look for directions to submit questions for the panel after the completion of the panel. And with that, I'm going to turn this over to Will Humble to begin the panel discussion. Thank you.
Thanks, Dr. Jacobs, and thank you to all of you on here, both for your participation on the panel and those of you journalists out there that are interested in covering this really important topic. So we have several really talented and respected speakers on the panel today. We're going to be covering aspects of the pediatric aspects of this, the pediatric health, the clinical pieces, parts as it relates to medical school ethics, the legal aspects with Dr. Braza, and finally Dr. Kathy Hoffman, who's going to be on here at the end. So please stay tuned for all of us. We're going to be moving pretty quickly here. We're going to keep it to about 5 minutes for each introductory comment, and then we'll have, as Dr. Jacobs said, Q&A at the end. So with that, let's go ahead and jump in right away. First, I want to introduce Dr. Sean Elliott, who is representing the Arizona Academy of Pediatrics, and many of you have recognized him throughout this pandemic as a real go-to source for actual evidence-based information about what's both happening in the field and epidemiologically, particularly with kids here in Arizona. So take it away, Dr. Elliott. Thank you.
All right, thanks, Will, and thanks, Dr. Jacobs. Good morning, everyone. It's a pleasure to be here. As Will said, I am the medical director of infectious diseases and immunizations for the Arizona chapter of the American Academy of Pediatrics, also emeritus professor of pediatrics at the University of Arizona. And I think, to my mind, most importantly, I'm a practicing pediatric infectious disease specialist. I am seeing the children that we're going to be talking about today in hospital, in clinic, and in the emergency department. My job is to lay the groundwork. Why are we even here? What are we seeing both in the community and in the country? I think everyone is quite aware that the United States is in yet another surge of COVID-19 cases with significant impacts on adult patients. However, and unfortunately, and perhaps in a unique way, we are now seeing a significant impact on pediatric patients. Historically, from the start of this pandemic, pediatric patients have accounted from 14.1 to 14.3% running average of all COVID-19 cases. Already in the last 3 weeks, that running average is up to 15.7%, which doesn't sound like a whole awful lot until you look at the week-to-week average. Arizona has seen a 50% increase in hospitalizations of children due to COVID-19. We've seen overwhelming runs on emergency departments, and we'll hear more about that from Dr. Koyama, who will follow me. And even other parts of this country, states in general, are seeing an 80% increase in burden of pediatric COVID-19 cases. So this is not insignificant, just very specific case in point and pertinent to today's conversation. In my county, Pima County, we have had over 100 new cases of pediatric COVID-19. Again, doesn't sound like a whole awful lot, except that all of those are school activity associated. And unfortunately, all those, with very rare exceptions, are coming from the one school district prior to this last week that opened up for in-person education. So one school district accounting for a significant number of cases. This is not an insignificant burden on the health of Arizona's children and the country as well. So why? What is different? And again, I think we can point to the smoking gun, that Delta variant, or the B1.617 subvariant 2, initially described in India. What is known about the variant? Number one, it is accounting today for over 93% of all new COVID-19 cases in this country. It is quite reasonable to expect the Delta variant is also accounting for the increase in pediatric cases. The variant itself has specific mutations which make it far more infectious or contagious, more easily transmissible than even former variants. The very first variant described was the Alpha variant, the B1117 from the United Kingdom, and that was felt to be 30 to 40% more infectious than the original circulating strain from the outset, beginning in Wuhan province in China. The Delta variant is 55 to 60% more contagious than the Alpha variant. So we're stacking increased infectivity onto increased infectivity, which makes it far more likely, unfortunately, for children to now be the agents of transmission. We've been fortunate so far, truly, we've been quite fortunate that children have not been the ones likely to transmit disease to each other or to their adult care providers at home or to their teachers at school. It's been the other direction, right? Adults are infecting children who then have had mild or asymptomatic disease. However, this is a new game. And the new game is absolutely due to characteristics of the Delta variant, which now make it far more easier for children to infect each other through close transmission of respiratory droplets. That's the key word right there. And also to infect their teachers, the personnel at school, and to bring that virus home and infect their families. This is not new news, folks. This is what happens every year with influenza. It's always the children who bring influenza and rhinovirus that cause a common cold and respiratory syncytial virus. They bring them home to their parents, to their adult care providers, infect those individuals who then take it to work. And that's how our every year epidemic occurs. Delta variant has now fallen into that pattern. It's a new game, absolutely. So what can we do about this? Well, of course, the best treatment is prevention, vaccination. The current vaccines licensed in this country by emergency use authorization, meaning the messenger RNA vaccines and the Johnson & Johnson vaccine, all have proven benefit and have been reconfirmed to be effective against the Delta variant. They still work, and they work well. They're preventing severely symptomatic disease. They're preventing hospitalizations. Yes, there are breakthrough cases, but they are mild. And always one can hear stories of one individual being hospitalized despite vaccination. But in general, the vaccines are doing a wonderful job of preventing that severe disease. 95 to 99.7% of new hospitalized COVID-19 cases in this country are in unvaccinated people. Those are numbers which are a running total, and we've heard those all released publicly before. So vaccination, fantastic. Let's just vaccinate everybody, right? But unfortunately, the vaccine only has emergency use authorization approved for children ages 12 years and up. What about the younger elementary age and middle school age children? Not yet is the key word. The hope was to have a vaccine indication through the FDA by this time, or certainly by middle of September. However, due to a very appropriate transparency and I think a very rigorous safety precautions, the FDA, the Advisory Committee of Immunization Practices, and even the scientific review committees for Moderna and Pfizer for the two mRNA vaccines are all calling for increased numbers to be studied in that age 5 years through 11 years patient population before applying for an emergency use authorization. I fully support that. Transparency, safety, utility, efficacy, these are all incredibly important. So because of that, the deadline is being pushed back to mid-winter to get emergency use authorization for the mRNA vaccines for the remainder of school children. So that's a huge proportion of kids in Arizona, countrywide, worldwide, who cannot yet be vaccine protected. And yet we also now know the Delta variant has just as high a viral load, meaning infectivity in the noses of people who are vaccinated as in those who are unvaccinated. We're safe from severe disease. That's very true. That's critically important, but we can transmit that virus very easily. So what's left to do? Masks. It's a simple, straightforward answer. The rules have changed in this game. And so I absolutely support, as does the American Academy of Pediatrics, as does every scientific organization so far on record in this country, the use of masks universally to protect us from transmitting this disease. That's how we can get through this pandemic. Absolutely, that's what we need to do in the school setting. So with that, I'll turn it back to Will, and thank you all very much for your time here.
Thank you, Dr. Elliott, for that comprehensive review overall, but also about what you've seen clinically out there in the field. And that's exactly what our next speaker is going to talk about. Dr. Koyama is a physician in the field. She's out there seeing cases day to day, and she's here to talk about what exactly the trends that she's seen over the last few weeks, and in particular, what she's observing out there in the field right now, which applies to the importance of what we're talking about here today, which is using strategies, every strategy that we can to keep schools safe and to improve the likelihood of in-person instruction for kids. So Dr. Koyama, take it away.
Thank you so much for having me today. So good morning. Thank you for everyone joining us today. So I'm Dr. Atsuko Koyama, and I go by she, her pronouns. And as Mr. Humble said, I am a local pediatric emergency room physician here in the community. I'm also a parent of a child who cannot be vaccinated because she's too young. And I'm here to talk to you about what I'm seeing in local emergency rooms, as well as what my colleagues across the country, as well as here in Phoenix, are seeing. I have COVID positive patients. My numbers have been going up. Our ER volumes are increasing. I see kids of all ages, some with severe illness requiring admission to the hospital, sometimes to the ICU, as well as kids with common cold symptoms like a runny nose or a mild cough. Sometimes they have vomiting and diarrhea requiring IV fluids and anti-nausea medicines. I've seen kids also with long haul symptoms. I had a patient who had been infected about 6 months ago, and he had lost 15 pounds over the last couple of months, and he'd gone to several other ERs because every time he eats anything, puts anything in his mouth, it changed his sense of smell, and it smells like, he said, death. And so he gets very nauseous, he vomits. And unfortunately, the only thing I could recommend for him after making sure that he wasn't dehydrated was a ear, nose, throat referral. I have had kids who come in with brain fog, joint aches and pains, all likely due to long haul COVID symptoms. And I also admitted a patient for respiratory distress. He had asthma. And he was having difficulty breathing. The very sad part of that story too is that he had lost both his parents to COVID within weeks of each other. So this is definitely, the mental health issues as well associated with COVID are substantial. So many adolescents had a very hard time with in-home schooling, with the stress of having parents who are sick, stress of having parents who are worried about COVID for themselves and their family members, extended family members passing away from COVID. This pandemic has very much affected our children. Now with the Delta variant, we're seeing more severe disease. Myself and my colleagues across the country are seeing higher volumes, partly because of COVID, partly because people aren't masked and catching common cold symptoms. As many people may have heard about, RSV is another virus that is affecting small young children, babies, and there's an increase in hospitalizations for RSV. All this can be helped or mitigated by using masks. Also, because of this increase in children being affected by COVID and other viruses, our wait times in the emergency rooms are getting longer, meaning on the inpatient floor, there's just too many kids in the ICUs. And so they have to wait in the ER longer than usual in order to get a bed upstairs. And so, we need to keep our kids in school with their friends, learning from experienced teachers who received degrees in education. If we found out that teachers were not qualified to teach our children, there'd be an outrage. And yet that's what's expected of us unqualified parents becoming teachers if we have to go back to online learning, or as long as COVID positive kids are being sent to school, especially if their symptoms are mild. So I had children the other day who came in with mild symptoms. They were tested for COVID, but their results hadn't come back by the time the parents had sent their children back to school the next day because the COVID result had not resulted. And the vomiting had subsided, and there was no mask mandate at their school. And so then their COVID positive children were at school all day the next day. And so, again, I just cannot reiterate how tired we are, the emergency medicine folks, people in healthcare. We're tired of working, of asking others to continue to wear masks, of telling families that their loved ones are in the ICU, or having to give updates via phone that their loved one had died, because we are now limiting people coming to the ER or into the hospital with their loved ones. And that's what's happening. We're very busy. Texas has put out a call for extra medical workers because there is such a high volume of patients needing medical care, and this can happen to us. So again, I don't feel like this is the time to liberalize our infection control measures. My daughter and her friends did great wearing masks in preschool all day long. I wear a mask for 9 hours a day during my shift. This mask that I'm wearing right now is much more comfortable than the respirator that I also wear. I wear when examining patients with my face shield. It's scary for kids to see someone who looks like they're out of a alien movie. But this is what we're going back to. So if you or any of your children 12 and older have not been vaccinated, please do so. You can text your zip code to GetVax, GTVAX, or vacuna in Spanish, or go to our Arizona Department of Health Services.gov to find your closest vaccine location. COVID has no political or religious affiliation. It doesn't discriminate except for by vaccine status, which many of our kids are not eligible for. So hopefully, I urge all school boards, county supervisors, city and state officials, parents to stay strong, follow the science, follow the expert recommendations, and really advocate for masks to keep our community and our children healthy. Thank you.
Thank you, Dr. Koyama, for that perspective from the field, from what you've seen in the EDs and in clinic, your experiences as a mom as well. That's super helpful. And especially thank you for that reminder at the end about ensuring parents get their kids vaccinated. They're 12 and up. That's the single most important thing they can do to ensure in-person instruction and keep their kid healthy this fall. And it is so easy to get these days. The vaccine's so easy to find. It's not like there's a complicated appointment system on a website that looked like it was designed in 1988 or something. It's easy to get. And thank you for the reminder of where that's accessible. With that, we'll move to Dr. Shad Marvasti. Many of you recognize him throughout this pandemic as a voice of clarity. He's with the U of A College of Medicine, Phoenix. He's both an MD and PH, and he's here to talk about the evidence base for masks and some perspective about how that relates to young people in school. So Dr. Marvasti, take it away. Thank you.
Thank you very much, Dr. Humble, Dr. Jacobs, and esteemed members of the colleagues and press. I think this is a really auspicious and important event for us to raise the call of unity. As the speakers earlier have said, the need is dire. We have a greater share of children in hospitals and who are dying from COVID-19 than at any other time during this pandemic. While vaccines are still highly effective, this is a different situation, as was mentioned. Even those who are fully vaccinated can spread COVID because of the amount of the virus that still exists in their nasal and respiratory passages. To reiterate in terms of why the vaccine is effective, again, what we're seeing is that 75 to 85% of symptomatic infections can be prevented from full vaccination, and 90 to 98% of hospitalizations and deaths, which is one of the reasons why we're seeing so many children who are being hospitalized and unfortunately dying and getting sick from COVID now. It's really two reasons. One is because most of the children that we're seeing actually are unvaccinated. If they're 12 and above, they can get vaccinated, but either themselves or parents have unfortunately chosen not to get vaccinated. And then there's a big chunk of folks who are under the age of 12. I'm here as a physician, as a family medicine physician, as a public health physician, and as a parent of 3 children under the age of 12, all of who are not vaccinated, all of whom we had anticipated eagerly and hoped to be able to send back to in-person learning, because developmentally, that is really the best thing for children, not only socially, but also in terms of education and just development for success in life. Not being able to send them when they started school yesterday was really challenging and difficult for my wife and I. It's difficult for them. They've regressed socially and are not able to connect in meaningful ways with others, having to be online. We're hoping that the vaccine can be available so that they can go back to school. And I think this is something that most parents are facing. And that's part of the social contract when we look at public schools and taxpayer dollars, is to ensure safety in these schools so that our children can go to a safe environment, a learning environment where they're free from bullying and other issues of challenges, but also from infectious disease. And during a pandemic, from a public health perspective, we have to really follow the science. And unfortunately, initially masks and then vaccines have both been politicized in our country and in our state, leading to very stark divisions around ideology. Well, this is not an ideological question. As was mentioned earlier, COVID doesn't care if you're a Republican or a Democrat, whether you're liberal or conservative, it's coming for you. And if you're vaccinated, you have that shield of protection. And if you wear a mask, you have another shield of protection. Before the Delta variant, we were confident based on the data that people who were fully vaccinated weren't a source of spread to others. When schools had reopened and were able to provide options for in-person learning, we had mitigation measures in place. We had masks in place. We had distancing in place. All of these measures in large part have actually been removed. And unfortunately, the timing couldn't be worse, because the Delta variant is actually much more infectious, significantly more infectious than the previous variants. And yet we have much less in terms of mitigation measures. This is really something that creates ethical concerns, as Dr. Beda will talk about, but it also calls to question everything that's been happening in this pandemic. What is the role of public health and science if not to inform public policy? When it comes to mask wearing, shouldn't we be looking at the extent to which epidemiologically the virus is spreading in a given community in terms of community transmission, and thereby looking at and assessing the risk from an evidence-based perspective, and then deciding what are the mitigation measures that work? Masks are, inexpensive largely. They're very available, right, and can be distributed and easily used, but unfortunately they've been politicized. They don't pose a threat to health. They prevent disease from happening in a pandemic. And yet we're not even able to have our children have a safe environment with those masks. And that's why we really need to stand up and talk about this and have this dialogue. And we really need to do it now because the numbers are only going to get worse. If we look at where we are now, we are exactly where we were in November of 2020 at the same time, basically early November, in terms of nationally where the cases were, and we're on that upward slope. So you can see where things are going to get worse unless we do mitigation measures right now, which is why it's so critical for us to align public policy with public health and scientific expertise. You know, these organizations, these entities need to be aligned with science in terms of everything that we're recommending. And as was mentioned before, all of the scientists and all the medical and public health experts agree that masks are the best way to prevent the spread of the infection in schools, and they need to be required of everyone, regardless of vaccination status, because of the Delta variant. And moving forward, we need to just know that this is going to continue to change. Sometimes in this pandemic, we're 2 steps ahead, and then we're 1 step backwards. But that's the nature of it, and we have to be flexible to it, because remember, the virus is not waiting for when it's convenient to come and infect us. It's continuously trying to mutate. And as we let it spread, when we're not wearing masks, it will mutate and new variants will form. And you never know when the next variant could actually be fully resistant to our vaccines. So we don't want to take that chance, and we want to avoid the clear and present danger that exists for our children, our teachers and staff in schools now.
Thanks, Dr. Maravasti, and also thanks for your service throughout the pandemic to give some clarity to this whole issue without spin and so forth. Before we go to Dr. Beta, I just want to reinforce and give some color commentary on what Dr. Maravasti said about masking, which is this. We've heard so much from the governor about, well, if you want to send your kid to, and the health director for that matter, if you want to send your kid to school with a mask, that's great, go ahead and do that. But that misses the point of how masking works. The mask I wear protects you as much or more than it protects me. And so masks are really most effective, or really you could say even only effective, if they're universally applied. And so in a classroom setting, it's far better to have the entire classroom masked because it provides that multiplicative effect, preventing the particles from spreading throughout the room. And this idea that, well, just put a mask on your kid is protective is just hogwash, and it's not supported by the data. And yet the governor keeps talking about it over and over and over again. Let's use evidence to drive our public policy. So with that, Dr. Beta, it was a great segue that Dr. Maravasti gave for you to talk about the ethics of the societal and the social contract that we have with each other to protect our children, and how the policy that's in place right now is inconsistent with that ethical construct.
Thank you so much, Will, and everybody, for allowing me the opportunity to share some thoughts. Just by background, I'm a pediatric critical care physician practicing 40 years. Making those very difficult ethical decisions and medical decisions at the bedside for children, making the decisions, should we, do we, can we, and with that experience, we're seeing that now. I am now an ethicist, chairing the department at the medical school, teaching our medical students about medical ethics at the bedside. And as a side note, I'm on the Pandemic Ethics Task Force for the state of Arizona, where we have set up criteria and protocols for allocation of scarce resources. And that may lead to making those very difficult decisions as to which child gets allocated resources and scarce resources or not. So this has become a very difficult ethical foundational issue. And so I guess the big question from the ethical perspective is, when it comes to the protection of children, why not start with protecting their health? There's this concept that children are minors and they don't have any voice. That's not true. Children have individual rights as everyone else does. Now, parents make the decisions for the best interests of their children, and as such, if they're going to protect them, they should be extremely sensitive to the fact that the child's health is going to be one of the most important aspects of that child's life experience moving forward. There's no question that the moral and ethical foundation of of being a responsible parent in having children centers around protection. And that's protection from neglect, protection from abuse, and protection from health inequities. I have two grandchildren, 6 and 8, and they are in Houston. And my daughter-in-law is immunosuppressed. We are living that life right now, trying to figure out how are we going to deal with this issue with our two young grandchildren going to a school in Houston where it is extremely rampant, especially with their mother who's immunosuppressed. The issue comes down to children are demanding that they have a voice in their life, whether they're 2, 3, or 4, or 5, 6 years old. Their voice, even though they're voiceless, is look at me. I am a person. You brought me into this world to protect me, and so therefore I ask that of you. Masking is absolutely the best way to go and the only way to go for right now for children under the age of 12. And so we have a moral and ethical responsibility and obligation and duty to ensure that all children, regardless of age, find themselves in a situation where they are surrounded and embraced by a field of protection, so that they can in fact live a life experience that will be actually worthy of who they want to be and where they want to go. So I just bring that ethical perspective to the panel and to others. We have an ethical and moral foundation to be there for the children, protect them from all that they face. Thank you. Appreciate your time.
Thank you, Dr. Beta, for that perspective. That's really important. And
Will, we need you to
Sorry for
there
that.
you go. That's okay.
I apologize. Thank you for that perspective, Dr. Beta. That's really important. I think that's an under-discussed part of this whole pandemic, especially when it comes to K-12. So that's a really important perspective you just brought to us. Next, I'd like to introduce Dr. Braza. So she has a couple of hats that she wears at the U of A. She's the head of the area Health Education Center down at the U of A, but also has been a senior consultant for the Western Region Office of Western Region Office for the Network for Public Health Law. By the way, a terrific resource for any of you, if you have throughout your whatever you're doing within your job, the Western Region is there to give you very fast and really well analyzed legal help to help you make decisions. And we use the network all the time at AZPHA, and I used to use them back when I was at the State Health Department. So Dr. Braza is here to talk about the legal aspects of this, and I think you're going to be covering both. Well, I'll let you take it away. I would like for you to cover when is this law that Governor Ducey signed that restricts school districts from having mask mandates. When does that actually take effect? And was it constitutional given Arizona State Constitution? And I know you may have a couple of other things to cover. So take it away. Thanks.
Thank you, Will, and thank you for having me today. Good morning. I'm Leila Barraza. As Will mentioned, I serve as a senior consultant with the Network for Public Health Law Western Region Office. And as a public health lawyer, I want to give first the disclaimer that what I'm going to share today is legal background. It's not legal advice, but I want to provide the legal insights and background for the legislation that we have all heard about and seen and discussed. So first, I want to talk just about the legislation. So we all know by now that the Arizona legislature included provisions in the K-12 budget reconciliation bill, House Bill 2898. And these provisions related to restrictions on face coverings. There are two provisions, one restricting school district governing board or charter school governing board from requiring use of face coverings by students during school hours. And another provision that stated a school district or charter school may not require a student or teacher to receive a vaccine for COVID-19 or to wear a face covering to participate in in-person instruction. And that those provisions added section 15342.05 to the Arizona Revised Statutes. So the questions being a couple related to the legislation. The effective or the operative date is what I'll start with. Under the Arizona Constitution, legislation is not effective or operative for 90 days past the end of the legislative session, so the close of the legislative session. And that for this year, that date can vary, but for this year, that date of effectiveness is September 29th. So this time period, this 90 days, allows for the opportunity for referendum petitions. And there is an exception. This 90-day period does not necessarily apply if there is an emergency measure included, and there are some requirements for that. The legislation did include a retroactivity clause, and HB 2898 stated that the 15342.05, the provisions related to restrictions on face coverings, would apply July 30th, 2021. There's also discussion about single subject. So the Arizona Constitution says that going beyond the effective date, there's the Arizona Constitution contains a single subject rule as applied to state legislation. So the Constitution requires legislative bills to embrace one subject and matters properly related to that subject. So adding a provision banning face masks into the legislation concerning the statewide budget for K-12 schools is arguably unconstitutional pursuant to the single subject rule because the two subjects are unrelated. The Network for Public Health Law has been continuously tracking legislation that has proposed limits on public health authority across the country. And I'm happy to provide more information on that as you'd like. We have seen examples in various states of laws that prohibit requiring masks, banning use of quarantine, or limiting local health authority or local government response. But along that, we've also been tracking legal challenges. So we're tracking lawsuits that have challenged legislation or orders specifically related to face mask requirements. And so far, we've seen just recently, such as in Arkansas, a case decision just last week. In Arkansas, parents and school districts had sued, I believe, in separate lawsuits. And a judge decided last week, August 6th, that the state's law restricting the authority of state entities or political subdivisions of the state from requiring face masks, from requiring mandates on face masks was unconstitutional and based on equal protection and separation of power grounds. And to quote the order, the judge noted in the order related to equal protection grounds that, quote, it, quote, discriminates without a rational basis between minors in public schools and minors in private schools, unquote. Additionally, judges in Texas, 2 Texas counties issued preliminary injunctions against Governor Abbott's ban on mask mandates, Dallas and Bexar counties. And the mayor of San Antonio announced yesterday via Twitter that the local health authority there would issue a directive requiring face masks for K-12 schools within the county of Bexar. And I apologize if I'm not pronouncing that correctly. In Arizona, we also know there's been a lawsuit filed against Phoenix Union High School District, and a motion to dismiss has been filed in that case. And I think we will all learn more about that case shortly. So I think, Will, I will pass it back so we can get to questions.
Okay, thanks, Leila, for that legal help. And also thank you for the entire team there at the Western Region for all the help throughout the pandemic with the really fast and detailed legal analysis. I know the county health departments really appreciate your work as well. Next, we'll go to Chris Cotterman, representing the Arizona School Board Association. Chris is the person you see down at the Capitol, testifying in committees and stuff throughout the year, representing school districts. And he's here to talk a little bit about the perspective of what's been happening, and in particular, the issue around masking with school districts, and talk about a little bit about their perspective. So take it away, Chris. Thank you for your time.
Thanks, Will. Appreciate it. Thank you, everybody. Like Will said, my name is Chris Cotterman. I'm the Director of Government Relations for the Arizona School Boards Association. And I just want to take a minute, a quick minute to sort of offer, we've heard a ton about why this is important, why face coverings are important, why these mitigation strategies are important. I think it's important to note that school districts writ large don't necessarily disagree with that assessment, and we have a number of concerns that that make it very difficult. But the number one thing is this, as we've said from the beginning, the response to this pandemic needs to be a public health response with public health in charge. And we've said that from the beginning because school board members are not public health officials. There's been a lot of talk about local control, and that's a sacrosanct principle, and that is absolutely true when we're talking about decisions that school board members are elected and qualified to make. And yes, they're the ultimate responsibility. They bear the ultimate responsibility. But to ask a panel of 3 to 5 citizens who ran to make decisions about textbooks and curriculum and discipline and things like that, to make what can amount to a life or death decision for their students and staff is frankly not fair. And the fact that it's been more politicized now than when it was in the beginning is deeply unfortunate. And so, that hasn't been the case for a while, that public health has been really in charge, and certainly not now with the legislature having stepped in and made a law that's contrary to the guidance from federal health officials and local health officials. And I think that's the biggest thing to understand, is that districts are caught out in an unusual scenario here. It's not typical for the law to prevent schools from following best practices that are designed to protect student safety. That is not something that's a common occurrence, and typically it's just not done because we all agree that it's a bad idea. But that is exactly what's happened here. And so the way that it's working out on the ground is pretty straightforward. Bigger districts have been able to have larger case numbers and have it not be as big of a deal. You talk about districts like Chandler Unified. At Hamilton High School, which is a school that's about 4,200 students, they have 68 active COVID cases right now. They've had 36 for a total of 104. So within a month of school, almost 2.5% of that student body has been infected with COVID. In smaller districts, J.O. Combs is a smaller district out in Queen Creek. They have 66 cases at one of their elementary schools right now. They've been on the news because they had to shut down their 5th and 6th grade classes because of it for a temporary amount of time. And then among the first districts we heard about, Ash Fork Unified School District up in Yavapai and Coconino County, they're a small district, and this is a different problem, which is going to hit rural Arizona pretty hard if we don't figure out what we're going to do. Because Ash Fork has 300 students, K through 12. They have about 15 teachers. And it wasn't the students that caused the problem, it was the staff. Enough staff becomes infected, you only have 15, they can't come to work, and now all of a sudden you can't operate your school district. And so that is going to become a concern for small districts. And the thing that I want everybody on the call to take away from this is that there is a lot of talk about local control versus mask mandates, and shouldn't just districts just do what the parents want. And I think that we've figured out that either side of this issue is pretty loud, but when it comes right down to brass tacks, it's a vocal minority that is anti these mitigation measures. When you put them in place, you see the same people over and over again pushing against them, where most parents are happy to have a place to send their kids to school even if they need to do things like, keep them home every once in a while when they're sick, have them wear a mask and things like that. And that's important to note, that we do believe that districts have broader authority than what certain people are saying that they do. So for example, requiring students to quarantine, that is something that districts can do. Enforcing limitations on the number of people on campus, that is something districts can do. If you don't have to be on campus, mask or no, you don't need to be there. And that's been the case always, and it's the case now. And as Dr. Barraza said, we are anxiously awaiting the outcome of this Phoenix Union case, because we need clarity on what the limits of district authority is and where it starts, where it ends. And we continue to urge districts to do everything within their power to contain the spread of COVID within the bounds of their authority. And so I'll leave it there, but the overarching message here is that school districts cannot be alone in trying to manage the mitigation strategies. They don't need interference from the legislature, and they certainly need support and direction from public health. And I will leave it there, Will, and we'll do some questions. Thank you very much.
All right, thanks, Chris. I think next we have a short video from Kathy Hoffman, Superintendent of Public Instruction. She couldn't make it today, but she did want to send in a quick video, so we'll cue that, and then we'll go to Q&A. So Trevor, you're in charge of that, right?
Hi, I'm Kathy Hoffman, Arizona Superintendent of Public Instruction. When this pandemic hit Arizona, the impact felt like a meteor crashing into our schools. And over the past year and a half, we have worked tirelessly to do everything in our power to ensure that our students, educators, and school staff are safe and protected from this horrible virus. And we're now in a different situation than we were 18 months ago. We've learned so much. We know how to keep our students safe and schools protected by encouraging everyone who is eligible to get the vaccine and to continue wearing masks until the number of COVID cases are close to zero. Recently, we know the virus has mutated and the Delta variant is much more contagious. But before the new school year even started, the GOP-led legislature and governor passed and signed a very short-sighted and irresponsible law that prevents mask mandates in schools, which is taking away the local control and preventing our school leaders from implementing policies that they need to keep their communities safe. Like many other states who have passed similar laws, Arizona is now experiencing a rise in pediatric COVID cases, and outbreaks are happening to various school districts across our state. I hope you will all join me in calling on Governor Ducey to repeal his anti-mask mandate law. This law takes away the local decision-making authority from our school leaders and ties their hands from doing what is best for their communities. It's way past time for this law to be repealed so that schools can prevent any further harm caused by COVID-19 and the reckless anti-science laws from this past legislative session. Thank you.
So with that, Will, did you want to do the piece about filling in any gaps, or do you have any comments you want to say before we start with questions?
Yeah, I wanted to get to Q&A real, because we're getting out low on time. There's one last thing that I didn't hear anybody talk about yet that I want to emphasize, which is that schools have at least some ability to control their own destiny. Yes, it would be great if they could were unimpeded with mask requirements, but a good thing this year is that because of the Rescue Plan Act, there's $129 million coming to Arizona for testing specifically in schools. And so schools can test their students either routinely for asymptomatic students using pooled testing, or they can order Binax now, that's the rapid test, the antigen test for their school, cost-free. Schools can contact their county health department who has the every county health department has access to the Binax Now antigen test. They can order those tests for their schools. Or you can go, and I did a blog post about this morning. The state health department has a contract with a vendor that's setting up pooled testing that allows schools to do routine asymptomatic screening of students, obviously with the consent of the parents, using the PCR pooled antigen test. And that service comes with free administrative and technical support. And that's been kind of a barrier for many districts, not wanting to do pooled testing. But the resources that come with pooled testing make it as virtually, well, it's free and virtually staff free. So that's an important tool for districts to understand. They can at least do better testing in their school district, even if they don't have mask requirements, which allows them to then do quarantining of of positive students and their unvaccinated close contacts to prevent cascades of cases from happening within their school. So they're not helpless with this. And we're trying to get the governor to make some better decisions so that kids can have a better chance at in-person instruction in a safe environment. And we may get there through the courts. I doubt that we're going to get him to do it himself. I think it's going to have to be the judicial branch of government that forces this down the governor's throat. So with that, Dr. Jacobs, why don't you take the Q&A part of this?
Will do, Will. Thank you so much. And just for instructions for the media, if you could please phrase your questions as though you were asking it verbally. And if you do have a follow-up question that you'd like to put in the chat, please just briefly reference which question you're following up on. So there was a question from Ms. Danielle Kamara, and Dr. Koyama has answered it, but I wanted to repeat it just in case anyone wanted to add anything to it. So for anyone on the panel, especially the doctors, we are seeing the rises in RSV now as well. So Dr. Elliott, I see you on the line. Would you mind answering whether the rise in RSV in children is connected to COVID-19?
Yeah, sure. Thank you so much. Respiratory syncytial virus, like SARS coronavirus 2, is a respiratory virus. Yes, we're seeing increased numbers of COVID-19. Those are not causing the increased numbers of RSV and rhinovirus and parainfluenza and everything else. However, the mask strategies, which we had used so successfully previously in this pandemic, prevented, reduced, eliminated RSV and influenza from the last winter session. Those interventions have gone away. That's why we're having this session. And as the masks have gone away, as we've come out from behind our social distancing, the respiratory viruses have come back with a vengeance. So RSV, we should not be seeing that in August and September. It should be a winter month episode. We're seeing it right now, and it's exclusively due to the failure of ourselves to mask and to follow social distancing.
Thank you. Dr. Marvasti or Dr. Beda, did you want to add anything to that?
The only thing I'll just add is, again, just remind everyone, we had a very negligible and forgettable flu season this last year. And again, that's because of the fact that the masks work, the masking and the distancing and avoiding high risk indoor settings. That was even before we had vaccines available, worked to stop the spread. So that's the good thing. You get multiple uses for these masks because they stop other infectious diseases that are spread by respiratory droplets and aerosols.
Thank you. The next question is from Ms. Griselda Zatino, and I really apologize if I am mispronouncing your name. The question is for the panel: do you foresee schools needing to close again and go back to online learning if COVID continues to spread in schools?
I can jump on that first. I think that, yeah, the short answer is yes. Without any sort of effective without more effective mitigation measures in place, the only way to contain spread in schools is to not be there. And so the problem with that is, and this is going to get a little bit weedy, so bear with me. The problem with that is in Arizona, if you go online, you're not allowed to go online unless you're authorized to do so by the State Board of Education through something called an Arizona Online Instruction approval. And then second, when you do, you take a cut in funding. So you have 95% funding for full-time students and 85% funding for part-time students. So if you switch a student over to an online entity for part of the year, and then you bring them back, you just lost 15% of your funding for the time of year that you were closed. And if you were closed all year, then you got, you're 95%. There's a lot of technicalities there, but the important thing to remember is anytime a school district goes online, for the most part, they're going to experience a reduction in funding because of the way we're set up. Our online instruction system is not designed for open, close, open, close. It's designed for students to select an online option for them, with the theory that it costs less to administer an online program because there's no bricks and mortar. That's not the case now. Costs are increasing, things like that. But the answer is yes. If we can't get a handle on this, then one of the only tools available to districts is going online, at least for a period of time.
Thank you.
I'll follow up on that if I may, just very, very quickly. I absolutely agree that this is not based on a whim, that this is the health and safety of children we're talking about. And if we cannot do a simple thing like, requiring masks, even supporting mask use at the highest level, then children will continue to increase in their hospitalizations. And those of us who care for these kids, look into their eyes. These are kids who are scared. They cannot breathe. I mean, it's a simple thing, I would hope, to decide for the health of our children. If that's what is necessary to close schools, then that's what we have to do. But nobody wants to do that. We want to keep the kids in school.
Thank you very much to Mr. Cotterman and Dr. Elliott. We have another question from Ms. Stephanie Innes. She asks, could the director of the Arizona Department of Health Services be doing more to prevent spread of COVID-19 in schools? And if so, how? And I can take this question. The answer is yes, she could be doing more. The messaging that's coming out from the Department of Health Services right now does not include regular and consistent messaging surrounding masking. The CDC does recommend it, as we have been informed of earlier, that all children in schools should be wearing masks, whether vaccinated or unvaccinated. And that messaging is very clear, but we are not getting that from our state health department. Would anyone else like to comment on that?
I gotta say, nor have I heard anything both on social media or anywhere from the health department encouraging school districts to implement a routine testing program. They have a big contract for free pooled testing. Any school district can participate for free, and they're not advertising it. And so even though the governor has, made this bad decision around signing the bill, he thinks prohibiting mask requirements, I don't think it kicks in until September 29th. There's still things schools can do, and testing is a really important key element of that. And schools can do this, and we're not seeing any of that from the state health department. That's an easy, seems to be risk-free way for them to promote school participation in testing.
Yes, thank you so much for that. I'm looking for more questions. Do we have any more questions from the media at this point?
If not, if I can make a comment from just the pediatric and moral and ethical side, I think as soon as and I believe it's going to happen soon, as soon as we start seeing mortality statistics related to children, you're going to have people looking at themselves in the mirror and finally understanding and realizing what they have done to children. We need to begin to prepare for that. And when those mortality statistics start coming out with children 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, when those start coming out, I think we're going to see a lot of people, again, looking at themselves in the mirror saying, oh my gosh, what have I done? So, the issue from the ethical perspective is why wait till then? But what's the deal? We all know better. And we have this intuitive foundation of doing what is best and right for our children. So I just want to make that comment. So pretty much wait for it. Wait for the mortality statistics to come in.
I'd like to follow up, and then thank you, Dr. Beta. If we're thinking, well, that's not going to happen in Arizona, just the simple facts of this: Arizona is number 2 in the country for pediatric deaths related to COVID-19 already, 34. We're second only to Texas, and there's a huge discrepancy in pediatric population numbers. So you might argue in numbers of childhood deaths from COVID-19 per pediatric population in this state, we're the worst in the country. In fact, we know Arizona has been worst in the world with our cases in the past. We're already not doing a good job at protecting our citizens and our kids. So that is I think, a very fair warning. I would certainly not want to be a doomsday prophesier, but I think we need to be very conscious that children will start to die from this once again.
I just want to be clear, in the emergency room, people are bringing their kids in because they're scared and they're worried. They're willing to bring their kids in when they're concerned about their own children, and yet they're not masking outside. They're not getting vaccinated. I ask all parents of the kids who come into the ER, have you been vaccinated? Are people in your family 12 and older vaccinated? And everyone has very different reasons for not getting vaccinated, and I respect that. Some of it is access, some of it is the parents are working 3 jobs a day. But we know that masks help. And when people come in, their kids are struggling to breathe, they're vomiting so much, they're dehydrated, and then I have to try and get an IV in them, but they have no fluid, no intravascular volume, because they've been vomiting all day, and then their child gets poked over and over again, which is not it's not our fault that their child is so dehydrated. It's COVID, and it's very emotional for everyone involved, and it's tiring also for all the healthcare workers. And if we get sick, we don't have a huge workforce either, and we have a nursing shortage in our country. We have long wait times in the ER. So as this gets worse and worse and worse, we will see sicker kids. It will take longer for us to take care of them, and they will again, as everyone has been commenting on, the morbidity and the mortality, the deaths will start coming. And having to tell a parent that their child has died or is in serious condition and needing ICU care takes a toll on us as healthcare workers. So please encourage masks.
Thank you so much. We do have another question, which I'm going to get to in just a moment, but I did want to add another thing, which is this: mask wearing has no risk attached to it. So a lot of parents are enraged right now, and justifiably so, because we are in a situation that is completely irrational. There should be no objection to masks. There is a huge risk associated with not wearing masks and not mandating masks. There is no risk associated with wearing masks, and it truly is that simple. So let me get to the next question. This is from Jessica Wani, who asks, how is the rise in cases affecting access to other types of medical care in Arizona so far for adults or pediatric patients? And if there aren't changes yet, what are you expecting to see in the coming months?
I can go ahead and take that. As mentioned, I'm on the Pandemic Ethics Task Force, and our charge is to look at allocating resources. We have now found ourselves looking again at allocating resources such as ventilators, extracorporeal membrane oxygenation machines, et cetera, because of the increase in the COVID cases we're seeing in children. And we are now having Zoom meetings with our team, looking at how many ECMO machines we have available, et cetera, how many hospital beds, ICU beds are available. And we don't want to get to the point where we're going to have to make those decisions as to who gets what. So the direct answer to the question is yes, it is affecting the additional medical care that's needed to take care of everyone. So that is the case.
Thank you very much. We have another question, and this one is from Ms. Rebecca Cheng, I believe. How well is Arizona tracking how many kids are infected with the Delta variant? And how well is the state doing with releasing data on cases, hospitalizations, and deaths? Will, I don't know if you wanted to comment on that or if anybody else wants to. Okay, here
I'll
you
jump in while Will is getting queued up there. The short answer is we could do a lot better. As with all pediatric data from the American Academy of Pediatrics, it's coming from state health departments' data. But the definition of what counts as a pediatric patient is different from state to state. Arizona counts birth through 19, other parts of the country birth through 14. So to make national predictive trends is very difficult because we may be comparing apples and oranges. Arizona's data does include some college age students. So take what we're saying with a grain of salt. In terms of looking for the Delta variants, that there are very few resources in the state to actually do the testing, the typing of the strains. And so a large part of our predictions are based on just a few cases, the few specimens which are sent to ASU for further typing. But again, we can make predictions based on what other states that have much more active typing abilities are able to share. And I'll turn it over to others who have additional thoughts.
Okay, seeing no comments on that. We have another question from Dr. Dreyfus, who is asking, how can we get vaccine into emergency rooms and clinics so that we can catch people who may be falling through the cracks? Does anyone have any thoughts on that? Dr. Marvasti?
Well, I'll defer to Dr. Koyama, who works in the emergency room on that one. I think in the clinics, obviously, I think we had a big complaint about that early in the pandemic in terms of getting to the outpatient clinics, having access, because remember, people really trust their doctor more than anyone else in terms of healthcare. And, you know, who else better to combat misinformation and also provide a convenient access point for you to get the vaccine than your primary care physician. And so I think we really need to do more in terms of getting it to primary care physicians. And when we look at the places in the community and zip codes that have been disproportionately impacted, and I'm talking about Black and Brown communities and social determinants of health at work, the community health centers and the federally qualified health centers and the free clinics, these are really places that we need to have as much vaccine availability as possible, as well as outreach programs with community or groups and organizers, local churches, community centers. These are really the places we need to get it to, and that's where we have to combat that. And I think misinformation is a big part of it, but having it to the people that are already trusted, whether it's someone from your church or someone from your local community group or organization, and they're talking about it and they have access to it, it can make a big difference. And obviously the emergency department is also a great place. So I'll let Dr. Koyama talk about that.
So I think the ER sounds like a great place, but I have to tell you, first of all, we're limiting the number of people who can come with a patient because of COVID. So then that limits the number of people to begin with. And then also, as Dr. Marvasti said, people trust their doctor. They do trust the ER doctor, but we're not the primary care physician, right? We don't have a long-standing relationship with folks. And thirdly, as I said, the ERs are thin. Again, we have a nursing shortage in this country. It's just, I wish that I could say that every single ER you walk into will have great resources to be able to provide excellent care as soon as you walk in, but our waiting times across the city differ by zip code, unfortunately, right? So there's healthcare access issues, as he spoke about social determinants of health. And so I think that the most important place and the place that we will get the most bang for our buck for vaccinations would be with the healthcare, the centers, health centers, community health centers with pediatrics. I know that a lot of my pediatrics colleagues, their private offices offer, that is where my husband got vaccinated at a peds office. So just local community health centers and private practice.
I would like to make just one very important point. I would not want anyone to leave this session thinking that vaccine access is a barrier. Vaccines are available. In fact, there are unused doses every single day, every single clinic, every single healthcare center in the entire state. That's not the problem. The problem is getting vaccine hesitancy to be addressed. And that's where the trust issue comes up with both Drs. Mavasti and Koyama have said. That's the issue. So thank you.
Thank all of you for your really important insights there. So I think we have one or two questions left, and I know everybody's got to go. Got busy people on this call. So Ms. Griselda Zatino asks, are the kids ending up in the ICU those that have underlying health conditions?
I think that's a great question. And I am not an ICU physician, but I know for a fact that, yes, so, kids and adults with underlying conditions are at greater risk for severe COVID disease. That said, that does not mean that they that people without underlying conditions can get severe disease. Because I know for a fact, as I said, I have friends all across the country in emergency medicine, in ICU medicine, and there are pediatric cases of kids needing the extracorporeal or heart-lung bypass machines because of their illness, needing to get breathing tubes down their throat because they can't breathe. And these are kids and adolescents who have no underlying illness. So is it common? No, like we've said, this is not common, but when it happens to you and your family and your child, it's 100%, right? It's 100% of your family, of your children. So yeah.
I'm just wondering if my pediatric colleagues could also comment on the risk of long COVID in the adult population. Also, obviously, in any population, whether you have an underlying risk or not, anybody with even a mild infection is at risk for long COVID. And I don't think we mentioned long COVID, but that's another thing to think about when we talk about masking and mitigation measures for everyone, regardless of vaccine status. It also is that risk too. So it's not just, oh, I had a sniffle and that's all my COVID was. Well, you could also end up with long COVID, and that's a reality, for anyone, honestly. So I don't know if you're seeing any trends in the pediatric population with that as well.
Yep, I'll handle that. Absolutely, yes. Thank you for that. Although the risk in pediatrics is much lower for long COVID or long haulers than in the adult population, that again is expected to change with the Delta variant. Again, this is a new game. It's a completely game changer. And yes, I am seeing patients with long COVID complaints in my ambulatory ID clinic almost every week. And as we've already heard Dr. Koyama share, this is not insignificant. They can't eat because food tastes, I think the Tim like death. I mean, that's a perfect description. Death or gasoline coupled with dog poop is what another of my patients described. Not insignificant. The fatigue, the deconditioning, all of these are extreme. And these are kids who are highly productive student athletes, you name it, who are now completely out of commission. And just to follow up briefly, in terms of the children hospitalized in ICU, exactly agreed. Some do have comorbidities, obesity, diabetes, et cetera, and so forth, but many do not. And especially because we're seeing other respiratory viruses. The last 3 that I've managed who were super sick had SARS coronavirus 2 and another respiratory virus. And that was an extremely horrible combination for them.
If I may, I have the great privilege of being a principal investigator along with 4 other of my colleagues of the Arizona cohort, which is a prospective cohort study of COVID-19, which we started in May 2020. And we published our first results paper. It was written by Dr. Melanie Bell and the rest of our team. And it shows that 2 months after diagnosis, 77% of our study population is still reporting symptoms. And we are still following that to see how long this lasts. But it is really important to point out that the people in our study are generally not those that have been hospitalized. These are people who had mild or moderate COVID-19. So I'm going to go ahead and finish it up with one last question that's up here, which is, How do we get the Arizona State Legislature to correct their error in prohibiting mask requirements in schools? Does anyone have the proper weaponry that we could use for that?
I'll take that one. It's the judicial branch. It's the third branch of government, the judicial co-equal branch of government. That's where I think the solution lies. There are multiple, both constitutional and other arguments that can be made. In fact, just while we have been on this call, two judges in Texas have thrown out Governor Abbott's mask mandate based on, I think, in loco parentis argument. So there are multiple very strong legal arguments. And I think the only way to get Governor Ducey to change his mind is to have the judicial branch cram it right down his throat. And the same thing goes for the state legislature.
And Lela, did you have anything you wanted to add?
No, I think there's a couple options in general of what repeals a law. As Will mentioned, if a judge declares that the law is finds the law to be unconstitutional, that would be one way that a law would no longer be found to be enforceable or, constitutional, is through the judicial branch. There's also legislatively, if theoretically, if the legislature came back for a special session, there's ways to repeal existing statutes that way. We did see that, I believe, in Arkansas, the governor was vocally saying that he wanted the legislature to come back related to their law. That was prior to the judge's ruling last week. So I think that there's, I guess a couple avenues that theoretically could occur.
Thank you all so much for that. And now I'm just going to close this with a couple of comments. We do have a website. Again, this session was sponsored by the Arizona Public Health Association, as well as our organization, which is righttosafeschools.az.org. So if the media would like to follow up with us, that is where we can be found. It's safeschools.az.org. On that website, you can find an open letter to Doug Ducey, which we have been circulating for a few weeks now. The last I heard, we have more than 8,000 signatures from parents who are concerned about the lack of public health mitigation measures in schools. We also have a list of resources, studies, scientific evidence that shows how the best techniques for keeping children safe in schools. And finally, we have a COVID-19 mitigation advocacy toolkit, which frankly has already been beta tested by our entire group, because there were a whole lot of us at school board meetings last night, and we were communicating with each other as we all spoke. So those are some of the things that are available. We also request that if you have follow-up questions, to please feel free to reach out to the panel and through their email addresses, which I believe we have provided. And that way we can get in touch with you and follow up to any queries you may have. So I would like to close by saying thank you so much to our panel. These are folks who have been fighting since day one and are busy. You're seeing ER docs here and public health professionals, and Mr. Cotterman from ASPA, who I can only imagine what the Arizona School Board Association is going through right now. Ms. Barraza, who is a lawyer with no peers among her colleagues. She is an outstanding public health advocate too. And Kathy Hoffman for providing her taped speech as well. So with that, I think we're going to close, and I thank you all so much for attending this very important session. Thank you.